Adult foreskin is the size of that bloodstainment info card. It's a double layer of skin, so it folds in half and wraps around, and that's what covers the head of the penis in the intact male. The outer foreskin is like an extension of the shaft skin. The inner foreskin is the mucous membrane, like the inside of your lip or the inside of your eyelid. And then between these two skin layers, you have the dartos fascia muscle tissue. That's the same muscle that's in the scrotum that responds to temperature to bring the testicles closer to the body if it gets cold. It works the same way with the foreskin and the head of the penis. Also, you have lots of blood vessels in here. You have lots of nerve pathways that terminate in Meissner's corpuscles, which are very fine touch nerve endings like you have in your fingertips and in the lips and in the clitoral hood in the female, which is the analogous structure to the male foreskin. And the head of the penis sits inside here, and this entire structure is destroyed when it's amputated, and then the head of the penis becomes an external organ. It should be warm and moist and protected all the time, like your eyeball or your tongue. But then it's when the foreskin is not there, it's exposed to the air, it dries out, it gets covered with a layer of keratin, like a callus from rubbing up against the underwear. And so you lose the sensation in the part of the penis that remains. Of course, you also lose the sensation in the part that was destroyed. And it's also very destructive for the mechanics of intercourse, because when the foreskin is there, it will retract back and forth across the head of the penis as the man goes in and out of his partner. And the lubrication will stay inside, whereas if the foreskin is not there, every time the man comes out of his partner, the lubrication is caught behind the coronal ridge and drawn out into the air where it will dry out. So it's a very destructive thing to do to the human genitals, to cut off the foreskin, which is a normal, healthy, valuable part of the human genitals, and which is being destroyed by doctors who do not understand the functions of the foreskin, and they do not understand the body part that they are amputating. So we're here to educate the doctors of America, because most of them did not learn the functions of the foreskin in medical school, and they do not have foreskins, and their medical school professors did not have foreskins, and they don't have any experience with this. They're destroying a body part that they do not understand.